Good evening, doctor. Today we have here Dr. Venkatachalam from Jipmer. Doctor, you finished your MBBS from Jipmer Medical College. Can you please introduce yourself? After that, what you did from your medical profession?
Actually, I finished my MBBS in 1974 from Jipmer, and after my house agency, I joined for junior residency in orthopedics. But at the same time, I had applied for commission in the Army Medical Corps, and uh, and I was selected for as a captain in the Army Medical Corps, and so I made a choice that I should serve the nation, and that was one of my childhood ambitions. And so when I got selected, I was quite excited about it, and I went ahead and joined the army. And
After that, where you are posted, and can you share your experience about your profession?
yeah, that was a really a very long journey of about 26 years in the Army Medical Corps, and although for the I got my first posting in military hospital Trivandrum, but I was there only for a month, and immediately after that I was sent for my basic officers medical officers basic course at Lucknow at the um, Army Medical Corps and Center. And following the successful completion of the MOBC course, I was sent on first posting to the field area in J&K, where that is one of our field formation medical units, and where I served. And thereafter, of course, I had uh, many postings.
You even served in Antarctica.
Yes. So from J&K, I went to Nagaland, and from Nagaland, I went to Amritsar. From Amritsar, I went to do my post graduation in Armed Forces Medical College. And after I finished, I worked at Orthopedic Center in Karki, that is Pune. And I also worked in Army Hospital Delhi for a year. And after that, I was posted to a place. And then from there, I was posted to Kalimpong, again in a field formation. So after that, after I finished my tenure in Kalimpong, I was selected for the Indian scientific expedition to Antarctica as a specialist medical officer. So that was a very, very interesting turn in my career, where I spent 16 months in Antarctica. And contrary to what I expected, it turned out to be quite an eventful tenure for me, because I had to handle cases outside the purview of my specialty, which is anesthesiology. But I could manage quite a few challenging cases like myocardial infarction. There was a blast injury of the hand. I had to repair the tendons. There was a case of appendicitis, and I had to do the appendectomy. And we had head injury cases. We had recurrence of malaria, and many such extraordinary situations which I had to tackle. We also had 4 deaths due to carbon monoxide poisoning, and the whole management of preserving the bodies and then having them sent to India on a chartered Russian flight. All these things was a very, very unique experience, and full credit to the training that we got in the Army Medical Corps. We were actually geared up for all such situations, so it didn't really come as much of a burden to me.
You had such a busy professional schedule. How did you manage your personal life, doctor?
Yeah, that is another big story, because I'm grateful to my wife, because she had to bear the brunt of the whole thing. Because when I was in Antarctica, my children were quite small, and she had to manage all alone for 16 months. And at that stage of life, it was very, very challenging. But she took it in a stride, and she never posed any. Of course, there was a reluctance on her part to send me to Antarctica, but then I prevailed upon her, and I thought it was a challenge of a life which I should not miss. So anyway, she supported me, and she looked after my children with great care. And I think without any reservation, I can tell you that whatever they are today is largely because of her. I don't want to take a share in that credit at all, because bringing them up, looking after their emotional needs, the physical needs, and all other things, I think she played her part very well, and I owe it to her.
That's really
Entirely.
great, doctor.
Yeah.
Now both your children are married and you have 3 lovely grandchildren.
Yeah.
Can you tell a few words to all the medical doctors, upcoming medical doctors?
Yeah, see, medical profession is a very noble profession, but we should not be content with just pronouncing it as a noble profession. We have to really strive to follow the principles that define that particular thing as that profession as noble. That's very important. So, and that is a big effort. Your attitude towards your patient, to your profession, to your peer groups, to your society as a whole, and not equating everything with the money. If I do this case, I'll get this much money. That has never been in my mind, and it is not. It has never been, and it will never be, because even, and of course, as you mentioned, I have 3 granddaughters, real lovely children. My children are well settled. Daughter is in USA, my son is in Dubai, and I think we on our part now. I'm largely retired from my specialty practice, but as luck would have it, we chose to live in a senior citizens facility in Coimbatore, and I've been asked to look after the medical center inside the community. So even now I'm continuing my professional work with the same zeal, though the type of practice is very different. I'm not, and I don't have to attend cases like I did in the operation theatre or in the critical care unit or in the ICU or things like that. But certainly this practice is also challenging, because since I am the only medical officer in the community, I have to handle a variety of cases. It's not only a few medical cases. It can be any emergency. It can be a skin disease. It can be an ENT problem, an eye problem, and I have to have some kind of a solution immediately. Later on, I have the choice of sending them further to the specialist center. But then, as a person on ground, and I stay round the clock in the community, I'm supposed to look after them, and that's very challenging, and I'm enjoying it thoroughly.
Thank you very much, doctor. You have done great in your profession as well as in your personal life, and again in your retired life you are continuing your great service. Thank you very much, doctor.
Thank you so much.